Imagine a majestic horse, peacefully grazing in a sun-dappled field. And then just heartbreakingly, within a matter of hours, it succumbs to this devastating, mysterious illness. That's the tragic, bewildering reality of equine grass sickness, or EGS. Today, we're taking a deep dive into EGS. It's a severe and often fatal neurodegenerative disease that primarily hits grazing equids, horses, ponies, donkeys. Our mission here is to cut through the complexity, pull out the most important, sometimes surprising insights from specialist study guides and expert excerpts. Think of it as, well, your shortcut to really getting a handle on this challenging condition. We'll explore what it is, what might be causing it, how it impacts the horses, and what can actually be done to treat or maybe prevent it.
Yeah, it's a topic that really shines a light on the ongoing challenges in equine health. And while EGS does keep some secrets, especially around its exact trigger, our understanding of the pathology, the management, it's actually come a very long way. This deep dive is, I think, crucial for anyone wanting to grasp the real intricacies of this disease and appreciate why informed care and prevention are just so critical.
Okay, let's unpack this then. At its core, what exactly is equine grass sickness? What's actually happening inside the horse?
So at its very heart, EGS is a form of equine dysautonomia. Put simply, it's a severe neurodegenerative disease. What's happening is widespread degeneration of neurons, the nerve cells, in the autonomic nervous system.
The autonomic system, that's like the horse's autopilot, right?
Yeah.
Controls breathing, digestion.
Galley, all the involuntary functions, digestion, heart rate, sweating, you name it. So when those critical nerve cells degenerate, well, it leads to profound gastrointestinal dysfunction, just throws the gut completely out of whack. And you see a host of other systemic issues in horses, ponies, and donkeys, too.
That's a really powerful analogy, the autopilot failing. So is this a global problem, or is it more sort of confined to certain areas?
It's predominantly found in Northern Europe.
Yeah.
The UK, Ireland, Scandinavia see the highest rates.
Okay.
But what's really interesting, it's also reported in other temperate regions, New Zealand, parts of continental Europe. We've even had limited reports from North America. And what's truly fascinating, there's an identical disease called mal seco down in Argentina, Chile, the Falklands.
Really? Identical?
Identical. And another clinically similar one, Tambora, reported in Colombia. So that needs more investigation. It's just, bigger global puzzle. And just to give you a sense of the scale, EGS is estimated to kill 1% to 2% of horses in the UK every single year.
Wow, 1% to 2%. That's a chilling statistic.
Yeah.
Really puts the prevalence into perspective. Does this disease strike year-round, or is there a particular time when owners should be more vigilant?
Oh, there's a very strong seasonal pattern. The incidence is highest in spring and early summer. Think April to July, typically.
Right when the grass is lush.
Exactly. That timing coincides with lush grass growth. Though, some sources also point to peaks in both spring and fall, often following cool, dry weather. We're talking temperatures around, say, 7 to 11 degrees Celsius. It seems the conditions for whatever the trigger is are quite specific.
Okay, so the million-dollar question then. What causes this devastating disease? Is the answer clear now, or is it still, a bit of a mystery?
Well, the exact cause, that's still elusive, which is precisely why it's such a challenging condition for vets and owners. It's frustrating. However, the prevailing hypothesis, the strongest one we have, points towards a neurotoxin, specifically one produced by Clostridium botulinum type C, or maybe a closely related clostridial toxin.
Clostridium botulism.
Related, yes, but the mechanism here is thought to be different. Can I walk you through how this proposed mechanism might work? It's more than just a horse eating something bad off the ground.
Please do. How does that work?
Okay, so the theory goes, horses ingest Clostridium botulinum spores. These are pretty common, found in soil, decaying grass, that sort of thing. But here's the key bit. These spores don't just pass through. They actually germinate inside the horse's gastrointestinal tract.
Inside the gut?
Inside the gut, in situ, as we say. And right there, they start producing these potent neurotoxins. Once produced, the toxins get absorbed into the bloodstream, and they specifically target the autonomic nervous system. They essentially block the release of a key neurotransmitter, acetylcholine. It's like creating a functional denervation, cutting off the communication lines to vital organs.
So it's not just a swallowed toxin, but something that actually, brews inside the horse. That's quite a twist. What are the environmental conditions, then, and other factors? What creates this sort of perfect storm for EGS?
It seems to be a complex web of factors, really. Environmentally, there's a very, very strong link with horses grazing on pasture. It's incredibly rare in horses that are permanently stabled.
Okay, so pasture is key.
Absolutely. And the risk also seems to go up significantly on pastures that have had recent soil disturbance.
Like what?
Things like harrowing, rolling, excavation, even construction nearby. The idea is this might bring dormant spores closer to the surface where horses can ingest them. Weather plays a role too. Cool, dry spring weather followed by warmer, wetter conditions seems to favor toxin production, perhaps.
Hmm.
Other risks include sudden changes in diet, like suddenly turning horses out onto lush pasture after winter. Overgrazing is another one, or even grass damaged by drought. Oh, and high soil nitrogen content has also been flagged.
That's a lot of environmental factors. But you mentioned something earlier about management that really stuck out. Mechanical versus manual feces removal. Did I hear that right? Using a machine increases risk, but picking it up by hand reduces it. That seems
Yep.
backwards.
It does seem counterintuitive, doesn't it? But it's a genuinely fascinating detail that studies have picked up on. The hypothesis, the thinking behind it, is that mechanical methods like chain harrowing might actually spread and aerate the Clostridium botulinum spores more widely across the pasture.
Spreading the problem around.
Potentially, yes, bringing them into greater contact with where the horses are grazing. Manual removal, on the other hand, physically picks up and removes the source of the spores, reducing the overall load on the pasture. It really highlights how even subtle changes in routine management could potentially have significant impacts on risk.
That's incredible. What about the horses themselves? Are certain horses more susceptible?
Yes, beyond those environmental and management factors, certain host factors seem to play a role too. We see a peak incidence in young adults, typically horses between, say, 2 and 7 years old, maybe up to 9, though it has been reported in foals as young as 12 days and horses up to 47 years old.
So mainly younger adults, but not exclusively.
Right. There also seems to be an increased risk noted in native Scottish purebreds. Interestingly, horses with lower levels of antibodies to C, botulinum type C in their blood, also appear more susceptible. And other things, like recent stressors or stressful procedures, even recent administration of the wormer ivermectin, have been identified as potential risk factors too.
Okay, so once a horse is affected, you mentioned this breakdown in the autonomic nervous system.
Sure.
What's actually happening inside its body? Which systems get hit hardest?
So the primary pathology, the core damage, is what vets call a widespread symmetrical degenerative ganglioneuronitis.
Okay, break that down for us.
Sure. In simpler terms, it means there's a profound, pretty uniform degeneration of those crucial nerve clusters, the autonomic ganglia. These ganglia are like command centers for the body's automatic functions, and it affects both branches, the sympathetic, your fight or flight, and the parasympathetic, the rest and digest system.
So the whole control panel is affected.
Pretty much. The key areas impacted include ganglia, controlling the head and neck, the main hub for gut motility, that's the coelicomesenteric ganglion, the adrenal medulla, and really critically, the nerve networks within the gut wall itself, especially in the ileum, part of the small intestine. This widespread degeneration leads to that functional denervation we talked about. The nerves just stop communicating effectively.
So the body's control system for vital involuntary functions just starts shutting down. What are the most obvious clinical signs that stem from this? What do owners typically see first?
The dominant clinical sign, without a doubt, is profound gastrointestinal dysfunction. It's usually the most striking thing. Because the gut's nerve supply is essentially cut off, you see severe hypomotility. The gut just stops moving properly.
Right.
This leads to stasis, impaction, and ileus, which is basically a complete functional paralysis of the entire GI tract.
Paralysis of the gut. That sounds terrible.
It is, but it doesn't stop there. The widespread autonomic failure causes other telltale signs too. Profuse sweating, but often it's patchy. Tachycardia, a very high heart rate, and distinct eye signs. Ptosis, which is a drooping of the eyelids, and miosis, where the pupils become constricted, like pinpricks.
Droopy eyelids and pinpoint pupils? Okay.
Yes, and dysphagia, difficulty swallowing, is very common. You'll see horses struggling to eat, chewing for a long time, maybe dropping food, what we call quitting, or pouching it in their cheeks. Excessive salivation, too. You might also notice bladder atony problems urinating, and muscle tremors or fasciculations, little twitches, especially around the neck, shoulders, flank area. These can get worse if the horse is stressed.
It sounds like a whole constellation of signs. Now, I understand EGS is categorized into different forms based on how severe it is, and that affects the outcome.
That's right. There are 3 main clinical forms, and yes, the prognosis varies dramatically between them. It's really important to distinguish them. First, you have acute EGS. This hits suddenly, severely. Horses show the profound gut stasis, the stomach gets hugely distended, the gut is silent on listening, and often they have this profuse, spontaneous reflux fluid coming back down the nose.
Oh dear.
They experience severe colic pain, typically intractable, meaning pain meds don't really touch it. But here's a really interesting, almost paradoxical sign for vets.
What's that?
Despite these horrific GI changes, the actual abdominal pain the horse shows might only be mild to moderate.
That is strange. Why?
The thinking is it might reflect a dysfunction of the nerve pathways, the sympathetic nerves that normally transmit gut pain signals. The signaling itself is broken.
Wow. Okay. What else for acute?
Severe difficulty swallowing, that profuse sweating, muscle tremors, the droopy eyelids and constricted pupils we mentioned, a very high heart rate, 70 to 120 beats per minute, and deep depression. This form progresses incredibly fast, usually fatal within 24 to 48 hours. Euthanasia is almost always recommended, sadly.
Okay, so that's acute. What about the next level?
Second is subacute EGS. This has a more gradual onset, developing over maybe 2 to 7 days. The signs are similar to acute, but generally less severe. You'll see less intense colic, maybe intermittent appetite, weight loss starting, reduced fecal output, milder dysphagia, maybe just patchy sweating, mild eye signs, increased thirst. These horses often just look generally unwell, maybe a bit tucked up in the abdomen, some mild diffuse muscle weakness making them stand with their legs closer together, a base, narrow stance.
And the prognosis here, still bad.
Unfortunately, yes, most horses with subacute EGS are also euthanized or succumb to the disease eventually. The odds are still very poor.
Right. And the third form?
Finally, there's chronic EGS. This one is much more insidious, slowly progressive over weeks, even months. The absolute hallmark sign here is severe weight loss, or cachexia.
Cachexia. Just wasting away.
Exactly. Progressive emaciation, often despite owners trying desperately to feed them. You'll also see intermittent dysphagia, maybe with frequent choke episodes because they can't swallow properly. Reduced or absent cecal output is common. Their coat might look dull, patchy sweating, mild eye signs again, those muzzle tremors and weakness, and chronic ilesis. The gut is still not working right, just less dramatically than in acute cases.
Is there anything specific to look for with subacute and chronic?
Yes, a really significant diagnostic clue for both subacute and chronic forms, considered almost pathognomonic, meaning it points very strongly to EGS, is rhinitis sicca.
Rhinitis sicca.
A very, very dry nose. The nostrils look dry and crusty. That's a big flag.
Yeah.
The heart rate in chronic cases is typically milder too, maybe around 50 to 60 beats per minute.
Okay, so you've got these varied signs, some quite subtle, especially in chronic cases. How do vets actually diagnose EGS, and what other serious things do they need to rule out first? It sounds tricky.
It is tricky. Diagnosis is primarily clinical. It relies heavily on observing those signs we've discussed and, crucially, ruling out other conditions that can look similar. A definitive diagnosis before a post-mortem examination is often quite challenging.
What are the main things it gets confused with?
Well, for differential diagnoses, it's vital to distinguish EGS from other types of colic, especially things like impactions or other causes of ileus. It also needs to be differentiated from botulism.
How do you tell it apart from botulism?
The key difference is EGS mainly hits the autonomic nervous system, digestion, sweating, heart rate, whereas botulism primarily affects the neuromuscular junction, causing more generalized muscle weakness like flaccid paralysis. Other conditions to consider include certain neurological diseases like equine herpes virus, myeloencephalopathy or EPM, lead poisoning, simple gastric impaction, esophageal choke, or even severe enteritis or colitis.
So how do they approach working it up?
Well, the history is incredibly important. Is the horse grazing? Has there been recent pasture disturbance? Where is it located geographically? What time of year is it? These are all key clues. Then a thorough clinical exam, focusing on identifying those autonomic and GI signs. Passing an esogastric tube is absolutely essential, checking for reflux or stomach distension.
Are there blood tests or anything?
Lab diagnostics like blood tests are generally non-specific for EGS itself. They're mainly used to rule out other diseases and check for secondary problems like dehydration or electrolyte imbalances, maybe elevated muscle enzymes. Detecting the actual botulinum toxin is technically possible, but often difficult, slow, and not routinely done. What's really striking, though, is that experienced clinicians, vets who've seen this before, can often diagnose most cases based primarily on the clinical exam and that crucial history.
Really, just by looking and listening?
Often, yes. A key diagnostic challenge, especially in acute EGS, is that weird discrepancy we mentioned, the mild abdominal pain despite severe gut shutdown and that really high heart rate. That combination is a big red flag. Finding a large intestinal impaction in a grazing horse should immediately raise suspicion. And as we mentioned, finding that telltale dry nose, the rhinitis sicca, is a highly specific indicator for the subacute and chronic forms.
And definitive diagnosis.
Ultimately, the definitive diagnosis is typically only confirmed post-mortem through histopathology.
Looking at tissues under a microscope?
Exactly. Examining tissue samples, particularly from the autonomic ganglia and the nerve plexus and the ileum, will show that characteristic degeneration and loss of neurons that defines EGS.
Okay. It sounds like an incredibly grim diagnosis for the acute and subacute forms. What are the treatment options, and what's a realistic prognosis?
You're absolutely right. For the majority of cases, the prognosis is indeed very grim. Treatment is primarily supportive. There's no specific antidote, no cure for the neurotoxin damage once it's happened. And the prognosis varies dramatically depending on that clinical form.
So for acute and subacute.
For acute and subacute EGS, the prognosis for survival is exceptionally poor. Extremely poor. Euthanasia is usually the kindest, most recommended option because of the intractable pain, the severe and progressive gut paralysis, and just a vanishingly small chance of recovery. Supportive care, if someone wants to try, is really only for a very limited time. It involves intensive pain relief, 5E fluids, trying to decompress the stomach. But prokinetics, drugs to try and kickstart the gut, generally ineffective and potentially even dangerous in these severe cases. They just don't work when the nerves aren't firing.
You said there was a glimmer of hope for one form.
Yes, and this is a really critical distinction for listeners to understand. For chronic EGS, the prognosis is still guarded, definitely not guaranteed. But there is a chance. Approximately 50 to 55% of these chronic cases can survive.
50 to 55%, that's a lot better than zero.
It is, but, and it's a huge but, it requires incredibly prolonged and intensive nursing care.
That sounds like a massive commitment. What does that intensive nursing for chronic cases actually involve? What's the toughest part of that long haul?
It truly is a monumental commitment, a real marathon, not a sprint, for both the horse and the owner and the veterinary team. Dedicated intensive nursing care is the absolute cornerstone of treating chronic EGS. This means providing highly palatable, wet, easily digested diets. Think small, frequent meals, soaked hay cubes, chopped forages, mashes, special pelleted feeds, often fed right on the ground because swallowing is difficult.
Tube feeding, too, you mentioned.
Often, yes. Esophageal or nasogastric tube feeding is frequently required, sometimes for weeks or even months, just to get enough calories and hydration into them. And one of the toughest parts is the constant vigilance. You have to regularly hand-pick feces.
Hand-pick feces? Why?
To physically check for and remove any developing impactions because their gut motility is still compromised. Plus, constant monitoring of their weight, their hydration status, how much manure they're passing. It's relentless 247 dedication for a long time.
Wow. What else is involved?
Other supportive measures include fluid therapy as needed, maybe limited, and very cautious use of certain prokinetics like cisapride, though its availability can be an issue. Pain management with NSAIDs if they seem uncomfortable. And crucially, providing a calm, stress-free environment is vital, and absolutely avoiding access to lush grass. Gentle exercise, like hand walking, is good if they're stable enough, just to keep muscles toned and promote well-being.
Can they ever go back to grazing normally?
That's very difficult. A very slow, gradual reintroduction to perhaps short, sparse grass might only be attempted after the horse has gained significant weight back and most of the clinical signs have resolved. Honestly, many survivors are kept off grass permanently or only allowed very limited supervised access. And complications during recovery are common things like continued weight loss setbacks, choke episodes, or aspiration pneumonia from the swallowing difficulties. It's a long, hard road.
So given that treatment is such a heroic, often heartbreaking effort, especially for the acute cases, prevention must be absolutely crucial. What strategies can horse owners use to try and minimize this devastating risk?
Precisely. Prevention is paramount. It really focuses on trying to reduce the horse's exposure to whatever this hypothesized toxin is, particularly during those high-risk seasons and on pastures that seem higher risk.
So pasture management is key.
Definitely. It's advised to avoid disturbing the pasture if possible. Things like harrowing, rolling, excavation, especially during that peak risk time in spring and early summer. Managing the grazing itself to prevent overgrazing is also important. Overgrazing forces horses to eat grass right down close to the soil surface, where spores might be more concentrated.
Makes sense.
Implementing rotational grazing systems can help rest pastures. Considering reseeding with different grass types might be beneficial in some cases. Just maintaining overall pasture cleanliness, removing dead vegetation, providing clean water sources, preferably elevated off the ground, it all contributes to a healthier environment.
What about feeding? Does that play a role?
Yes, nutritional strategies matter. Providing supplementary hay and concentrates, especially when grass is really lush and growing fast, can help reduce the sheer amount of potentially risky grass they ingest directly from the ground. In areas where EGS is common, endemic areas, a highly effective preventative measure, though admittedly not always practical for everyone, is to keep horses stabled and on a hay-only diet with zero grass access during that high-risk spring and early summer period.
Stabling them completely during risk periods.
It's drastic, but effective if feasible. Also, being careful about forage quality, avoiding feeding silage or haylage that might be poorly preserved and potentially contaminated with Clostridium botulinum spores is important too.
You mentioned the Clostridium botulinum type C hypothesis earlier. Is there a vaccine related to that, and does it help with EGS?
Yes, that's a good point. There is a vaccine against Clostridium botulinum type C available in some areas where EGS is common, like the UK. Now, its primary license is for preventing botulism itself. However, there is some evidence suggesting that vaccinating horses with this C botulinum type C toxoid vaccine can help reduce the incidence of EGS.
So it might offer some protection.
It might. And this evidence actually lends more weight to that clostridial toxin hypothesis. If a vaccine against the suspected bacteria's toxin reduces the disease, it supports the link. But it's really important to manage expectations. It's not fully protective against all EGS cases, and it might not cover all possible toxin variants involved. So it's another tool in the prevention toolbox, but not a guaranteed solution.
Okay.
And just generally, for the horse's own susceptibility, trying to avoid sudden changes in diet or routine and minimizing stress wherever possible are always good management practices that might also help reduce risk.
Right. Minimizing stress is always good advice.
So let's try and bring this all together then. Equine grass sickness, EGS, is this severe, often fatal neurodegenerative disease. It seems primarily linked to a neurotoxin, likely from Clostridium botulinum type C, which attacks the horse's autonomic nervous system. It shows up in those acute, subacute, or chronic forms. The hallmark signs revolve around that profound gut paralysis, difficulty swallowing, weird sweating patterns, and those specific eye signs like the drooping eyelids. Diagnosis, mainly clinical, based on signs and history, often challenging. It's definitively confirmed post-mortem by looking at the nerve tissues. Prognosis is grim, extremely poor for acute and subacute forms, making euthanasia often the kindest choice. Yet remarkably, about half, maybe 50–55% of the chronic cases can survive, but only with incredibly intensive, prolonged nursing care. Treatment is purely supportive, managing symptoms because there's no antidote. And prevention really hinges on careful pasture management, avoiding known risk factors, maybe using the vaccine cautiously, and good nutritional strategies.
So what does all this mean for you, the listener, whether you own horses, work with them, or simply care about animal health? Well, understanding EGS really highlights this delicate, often unpredictable balance between the environment, microbes living in it, and animal well-being. It absolutely underscores the immense dedication, the sheer effort required for that long-term care in chronic cases. It's a truly inspiring testament to the human-animal bond, isn't it? And it reminds us of the ongoing challenge posed by diseases like this, where the exact trigger, that first domino, continues to elude definitive answers despite decades of research.
It really does, and it raises an important question for the future, I think. Considering the ongoing research and knowing the significant commitment needed for those chronic survivors, what new preventative strategies or maybe deeper insights might we uncover? How can we better protect these magnificent animals from such a devastating illness down the line? For you listening, what stood out as the most surprising aspect of equine grass sickness today? And based on what you've heard, what might you want to explore next about equine health or maybe pasture management?